Hey guys, I'm coming to you today with a message that I have been wanting to share for a little bit of time. I started this channel about a year ago, and it's been really heartwarming to see how many women have found it useful, how many people have reached out to me and thanked me for the content on the channel, and how many people that I would like to believe it's helping. But I do get a lot of kind of the same questions, like a lot of what I would call my frequently asked questions. And then also I read all of the comments that you guys put on the channel, and there are some comments that I repeatedly see that I would also say are misconceptions that I would like to clarify. So I just have a couple things, 2 or 3, that I wanted to chat about. That way, if anybody had these same questions, you have access to this information. And then also I could kind of set the record straight on a couple of things that people I don't think are understanding. So the first one is I get a lot of questions about and comments about my videos where I discuss the vaginal packing that I had. After my surgery, I had vaginal packing that was inserted, and many women have this. I would say actually all women after a vaginal hysterectomy or a POP procedure are going to have vaginal packing. But there is some that gets removed before you ever leave the hospital, like 24 hours after surgery. And then there is some like mine that had to stay in for 7 full days. I just wanted to clarify that the reason mine was in for 7 days and couldn't be removed prior to that was that I had the entire inside of my vaginal wall was restructured with stitches. So at least 3 different sections of my vaginal wall were stitched, like all 3 sides, but specifically the anterior side of my vaginal wall had a ton of repair. The way he described it, it's kind of almost like patching drywall. He said I had to go in and create structure. I had to stitch all of that up so that your vaginal wall could hold strong when those organs like my bladder continue to push against it for the next however many years. So the purpose of the vaginal packing is to go in there and create a barrier so that the folds of your vagina on the anterior posterior side cannot do what tissue naturally does, which is try to fuse together. So it keeps that area separated, prevents fusion, but also it helps to create a vaginal canal, which is what he was trying to do. He was trying to recreate my vaginal canal in a shape that is natural to how it should be. So I've had some borderline rude comments where people say things like, wow, you must have had a really terrible surgeon if he didn't take your packing out before you left. I only had mine in for 24 hours, so your surgeon must not know what he was doing. Or I've even had like, wow, your surgeon was really terrible that they didn't have you come into the office to remove that packing. So here's the thing. I've said this in, I don't know, 4 or 5 of my videos. Every woman's surgery is different. Every procedure is different. How it's done is different. And I've also mentioned in a couple of them that there are surgeons out there who are not doing this right. They are not doing this surgery in a way that's going to last you forever, that has those long-term repairs, and that is actually what your body needs. There's a lot of surgeons out there putting Band-Aids in and using a whole lot of mesh. If these problems are getting fixed with mesh, yeah, you wouldn't have a need for packing at all, except maybe to stop bleeding in the beginning. Mine was not to soak up bleeding, although I guess it kind of did serve that purpose as well. Mine was to reinforce my vaginal canal, keep it open, and prevent it from fusing back together. So that's the reason. And as far as not going into the office, I was hesitant about taking it out myself, and it was uncomfortable. It was not painful, but my surgeon's office was a good 40-45 minutes from my house. So to be quite honest, it was actually easier for me to do it from the comfort of my home, and I truly believe what the surgeon is trying to prevent is another reason for you to have to get out of the house, because you are supposed to be on pretty much bed rest at the 7-day mark. They don't really want you getting out, parking your car, walking into a doctor's office. So that's the reason for that. So again, Talk to your surgeon about whether you will have packing, how long will it be in, what is the purpose of that packing. But if your surgery is done like mine, with lots of stitching inside your vagina, you will have packing, and you will likely have it for longer than just your hospital stay. All right, topic 2, my catheter. Same type of thing. I'm getting a lot of questions, and I get some comments on my channel that I can tell clearly people are misunderstanding why I had that catheter, what the purpose of that type of catheter is, and why it stays in longer. So when you have nearly any surgery, you are going to have a catheter placed in your urethra, your pee hole, okay? That is called a mid-urethral catheter. That is also called a Foley catheter. There's several names for it, but it's what you get when you have an epidural when you have a baby. Like anytime you can't control your own bladder and you're just gonna pee on yourself because you're numb, they're going to put a Foley catheter in, okay? I had that when I woke up from surgery and for the first 12 hours or so, but I also had a suprapubic catheter. There's pictures of that on my channel in several of my videos, but essentially it was a catheter that was surgically inserted right above my pubic bone and like where my pubic hair was, and it went directly into my bladder. And inside my bladder, then there was a balloon holding it in there. They inflate the the balloon once they insert that catheter, so it can't come out of the bladder. But mine was there for a very specific purpose, not related to me peeing myself during surgery. Mine was there because I had a special kind of sling done called the TVT sling, where there was just a very tiny little piece of mesh, but it's actually like surgical tape that was placed right under my urethra. So picture your urethra tube. I had a tiny little piece of tape put under my urethra tube. Because of that, for approximately 7 to 14 days, your body struggles to push the urine past that TVT tape, past the tape, because your urethra is swollen, because it's kind of been through a trauma of a surgery. And also just it has to adjust to that pressure, because the whole point in that piece of tape for me was to create a pressure to hold that urethra up so I stopped peeing my pants when I coughed, sneezed, laughed, jumped, any of that. So I knew that was gonna happen. I was fully expecting that. And again, if your doctor just goes in and puts a big piece of mesh holding up your whole bladder, you won't have that, but you won't need it. But also your mesh is probably gonna fail down the road, because a large piece of mesh can only hold all your organs up for so long before it's going to fail. Also, all that mesh is not meant to be in your body. That's why I tell you to ask so many questions of your surgeon. When your surgeon does it right, like mine did, and uses a very small piece, you will have a suprapubic catheter, because your body has to retrain itself to urinate past the pressure of that tape down your urethra. So when I woke up from surgery and for 7 days after, I would try to urinate on my own. A little bit would come out in the very beginning, not much. The rest of it I had to drain with that suprapubic catheter. Then as my surgery recovery progressed, more was coming out of me and less was being drained out of that catheter. By the maybe it was the 10-day mark I got it out. Sadly, I can't remember. I'd have to go back and look. I think it might have been 10 days, 7 or 10. Regardless, what has to happen is your body has to urinate almost fully on its own with nothing remaining in that catheter before you get to take it out. That's the purpose of it. So again, I just want to clarify, I did not have a bad surgeon. If you don't have that, it doesn't mean your doctor did it right and mine did it wrong. In fact, I might argue the opposite. If you were getting a repair for stress incontinence, peeing yourself when you laugh, jump, sneeze, cough, you really probably needed what I got. If you got a piece of mesh holding up your whole bladder, it may work for you. I hope that it does. But in all of my research, it just shown that that really is a Band-Aid fix. And what I had done, although it sucked. If you watch my videos, you will see that that catheter was by far one of the worst parts of my experience. It was the right way to do it. Okay, that was number 2. Number 3, I get a lot of questions about whether I tried pelvic floor physical therapy or doing Kegels before my prolapse surgery. Absolutely. I did 2 separate rounds of physical therapy with a certified pelvic floor therapist to try to strengthen my pelvic floor and prevent me from having to have this, but it wasn't enough. Both of them had told me, my gynecologists had told me that because of the damage of my first delivery and then 2 very large subsequent deliveries after that, large babies, that my pelvic floor was just so weak and in such a state of disarray that no amount of Kegling could fix that. Like, I could tighten it, but then when you have another baby, you have another vaginal delivery, you just kind of undo all of the work that you've done. And when the damage is so severe like mine was, no amount of Kegling was going to fix it. So that's a question I get. Yes, I tried that, and I think for many women it can work. I think when you go to pelvic floor therapy, you need to make sure you're going to someone who specializes in that, not somebody who, you know, it's just another thing they do along with helping people recover from shoulder and knee surgery. It needs to be somebody who is trained specifically in pelvic floor therapy. But I need you to understand it's not going to work for everyone. No amount of Kegling can fix prolapses in your pelvic floor. It just can't fix it. It may prolong your need for surgery, like extend it, but it's not going to fix your prolapse issue. Okay. The other question I get related to pelvic floor therapy, because some people have watched some of my recovery videos further out, like at the 1 year mark, 18-month mark from my surgery, and they ask questions about, why am I still doing pelvic floor therapy now? Well, it's a totally different type of pelvic floor therapy. A lot of people don't even know this exists. So there's pelvic floor physical therapy for people who have a weakened pelvic floor, which is what I had before my surgery, which is why they're peeing their pants. You know, some of them are having fecal incontinence issues, pooping their pants. That's because your pelvic floor is too loose and you need to work on tightening it through various types of Kegels. What I'm going to therapy for now, or as of recently, I really do most of it at home now, which I'm going to explain in my upcoming 2-year recovery video. I sought this type of therapy after my surgery because the pelvic floor muscles were too tight. Yeah. And they were sporadic and kind of like they were having spasms. They were a little bit spastic, just too tight. And I also had some pelvic floor knots. So, because of the surgery, because what the doctor was doing was recreating my pelvic floor, literally restitching it back together. There was also a lot of scar tissue. So the restitching of it made it tight. The pelvic floor scar tissue caused some like knots and some tight spots and almost some it's like scarring, right? So about a year after surgery, I was having a lot of pelvic floor pain that felt like it did before my surgery. And of course, my first fear was, oh my gosh, I have another prolapse. I didn't though. What was going on was these spastic muscles in my pelvic floor, and the scar tissue was pinching nerves and causing pudendal nerve pain, which was shooting into my butt cheek, into my groin, down my legs sometimes, and just causing like a dull ache. So I was referred to pelvic floor therapy again, working on a completely different thing. I never do Kegels. In fact, my therapist now is like, don't Kegel, don't tighten it. Part of, I think, my problem was after my surgery, I was so freaked out about ever needing it again that I focused on tightening it all the time. If I was doing any kind of workout, tighten it. If I was bending over, tighten it. If I was going to lift anything, tighten it. She said, stop tightening it. Like, it's too tight. It's too tight. Focus on relaxing it. So a lot of my pelvic floor therapy recently has been deep breathing, relaxation techniques for that area, massage. My therapist, as well as my husband, is now trained to use their fingers to palpate that area, to basically feel for knots inside my vagina, down on my pelvic floor. And when they feel a knot, they hold pressure on it or they massage it until that knot is gone. Just like you would if you had a tight muscle in your shoulder, your leg, anywhere. You massage that tightness and that spastic muscle out, and then it releases the clamping down on those nerves that are causing my pain. Another thing that has helped me, and I talk about this in another video, but I didn't have it to show, is this. So this is from a company called Intimate Rose, and it's called a Pelvic Wand. And it is the only way that you can do physical therapy to relax your pelvic floor by yourself. Like, you really can't get your fingers in there at the right angle. So this, you can use this end or you can use this end. Mine vibrates. Honestly, I never turn the vibration on, and it is not for any form of pleasure. It's because the vibration is supposed to be more like a massaging motion. I don't turn that on. I actually think it's too intense. It's uncomfortable. But this can get at all kinds of angles in the pelvic floor to hit those different knots and tension spots if you don't have the option to go to therapy. Or my husband, bless his heart, he's really a champ. I just tell him like, hey, I'm really uncomfortable. I think I need some pelvic floor therapy. And he's really good at doing it. People laugh like, oh, I bet he enjoys that. No, it's not enjoyable for him or me. In fact, he says his fingers really cramp up and they hurt. And for me, it is very uncomfortable. It is painful. These knots are painful. And when he is putting pressure on it, there are times it's like not comfortable at all. But after he does the therapy, I have almost immediate relief that lasts like several days, or strangely enough, I notice it tensing up when I'm under a lot of stress, just like muscles in your neck would tense up. That area tenses up with that too. So that's what it is. I'm not at therapy doing Kegels. I have the opposite problem. I need to loosen my pelvic floor. Pre-surgery, you're working to tighten that. Now, there are some women who, even before having babies, before having a prolapse, they have too tight of a pelvic floor too. And that's why they recommend, if you're having any issues with the pelvic floor, you go get checked out, because you could be working on Kegeling and you need to be working on relaxing, like complete opposite of what you think you need to be doing. So it's very important to get that evaluated. I am at about 2 years past surgery now. So like I said, I'm going to be making that 2-year recovery video here really soon, but I just felt like I needed to get this info out. There's just, yeah, a lot of misconception, misinformation, and I just keep reading comments like kind of attacking my doctor, or like, well, they must be incompetent if they made you do that. No, actually, I'm pretty confident in all the research I did prior and now. My doctor did everything spot on, as the most recent research would say should be done. And he explained to me going in, I'm not doing this the quick way. I'm not putting a Band-Aid on this. This is going to be more uncomfortable than other women who you may have talked to who've had this surgery, but I can promise you that these are lifetime repairs. And that if you follow up with a lifestyle like you should be, never lifting anything crazy. I think my limit is supposed to be over 40 pounds. I sometimes break that because I have a 5-year-old I pick up from time to time. But he fixed it using native tissue, my own tissue. Therefore, I don't have a bunch of mesh to break down over time to cause like infection and inflammation where it's connected to my tissue. He did it right. So I hope this helps clear up a few questions, and if anybody has questions about those 3 things, they can watch this to figure it out before they feel like they have to ask me. Otherwise, I absolutely love getting your emails. I get emails from women who just have a specific question or a surgery coming up. They want to like thank me, or, you know, ask me if I experienced a specific thing. Love getting those. I always try to respond. I read all the comments. I can't respond to everyone, but I do read those. And then I've said this in other videos, but I would just ask that you please subscribe, like, all of those things, not because I'm trying to get famous off this channel, obviously. In fact, I don't want everybody to know this about me, but I have found from research I've done that that's the way to get these videos viewed by more people. The more they are liked, the more they are subscribed to, the more that they will show up in the algorithm and into people's feed for them to get the information that they need. So thank you for watching, and I hope you find this useful.